We're so glad you could join us for On Call for All Kids. Today, we're going to be talking about eating disorders in children and adolescents. We're going to get questions answered about the different types of eating disorders and recognizing one in your child, the health consequences of these chronic conditions, and how parents can support a child who is battling this disease. I am joined by Dr. Sarah Stromberg. She is a pediatric psychologist here at Johns Hopkins All Children's Hospital. So great to see you, Dr. Stromberg, and talk about this very important topic.
Thanks, Ashley. So excited to talk with everyone today.
And this disease, this can be eating disorders, can be very, very serious. So I'm glad we can kind of talk about those warning signs and what parents should look for. Well, let's start off talking about what is an eating disorder and what are some of those different types of eating disorders.
Sure. So eating disorders are really complex illnesses that have serious physical, mental, and psychosocial consequences, and they have really high mortality rates. Eating disorders really involve an unhealthy relationship with food, and they cause significant interference with daily functioning. So some examples of eating disorders include anorexia nervosa, atypical anorexia nervosa, bulimia nervosa, binge eating disorder, and avoidant restrictive food intake disorder, which sometimes we call ARFID for short.
And so for parents looking out for some of those signs and symptoms, what should we be looking for?
Sure. So in anorexia or atypical anorexia, some of the most common signs are when kids are making a lot of comments about their weight, if they're skipping meals or eating really little throughout the day. Those are signs that there might be a developing eating disorder. Some of our patients with anorexia restrict to as little as 300 to 400 calories a day. That fear of gaining weight and a lot of body dissatisfaction, those are also major warning signs of anorexia. In bulimia, it's a little bit different because there's a pattern of binge eating followed by what we call a compensatory behavior, which is something like forcing yourself to throw up or fasting or exercising a lot to prevent weight gain from the binge. In binge eating disorder, that involves eating really large portions of food and losing control where kids feel like they can't stop themselves from eating. ARFID is a little bit different in that it doesn't involve the body image piece very much, and it has a lot more to do with texture and sensory characteristics. So kids are sort of averse to eating certain foods because of the way it tastes or the texture of it. Some of them have a complete lack of interest in eating, or they have concern about maybe throwing up or stomach pain because of eating, and that keeps them from getting in enough nutrition. Some other signs to just look for across the board include kids who are hiding or sneaking food, or if they're tracking their calories a lot, if they're refusing to participate in events with food. Those are really critical signs of eating disorders.
If they are starting to engage in some of these eating behaviors, what are some of the consequences to this?
For sure. So there's a lot of medical and mental health consequences. On the medical side, it's a lot of concerns about low heart rate, hormone changes, fatigue. Sometimes we see hair loss or blood pressure changes. These kids often run the risk of fainting or passing out, and it can be really scary because it can even result in death. Mental health-wise, we're really concerned about social isolation, depression, loneliness, anxiety is really common, and even suicidal ideation.
What should we do if we know of someone who might be suffering from this or we see this in our son or daughter?
Sure. So we want to take these concerns really seriously. Eating disorders can be sort of a sensitive topic, but reaching out to a professional or a trusted adult is a critical step in recovery. So discussing with a doctor or a therapist can help your child receive the right care, an evaluation, and the best treatment plan possible.
And what can parents do to support their very own child if, in fact, they have been diagnosed with an eating disorder or they're seeing some of these behaviors?
Great question. It's really important to remember that eating disorders are both medical and mental health disorders. So it's incredibly difficult for children and teens to recover on their own. They need treatment and consistent support from their families. This means parents shouldn't be afraid to monitor what their child is eating, and they should really be closely involved to make sure they're obtaining adequate nutrition throughout the day. Parents might have to use some clever strategies to make sure their child is compliant with eating and not engaging in these unhealthy eating behaviors. It is a balance between empathy and being authoritative. So, as a parent, sometimes it can be tempting to back off because there's a lot of arguments at mealtime or because we feel like our child doesn't want help. But we want to resist giving into the eating disorder. Honestly, no child chooses to have an eating disorder, and the role as a parent or a caregiver is to help your child fight that eating disorder. And that takes a lot of time and effort, but family is such a critical component of recovery. And the more closely involved the family is, the better their prognosis is.
Well, Dr. Stromberg, thank you so much for all this great insight on eating disorders and how it does affect children and teens.
Thank you.
And thank you all so much for watching as well. Don't forget you can check out our website. It's hopkinsallchildren's.org/newsroom, and you'll find a lot of great resources there like patient stories and other timely topics in pediatric healthcare. We'll see you next week.